Have you ever felt a cough coming on and wished you had a secret tool to manage it effectively? For those living with cystic fibrosis, managing a cough is a constant challenge, but there are powerful breathing techniques that can help you take control. Yes, specific breathing techniques are indeed excellent tools to manage a cystic fibrosis cough. These methods are designed to help you clear mucus from your lungs more effectively, reducing the frequency and intensity of coughing spells. The reason these techniques are so effective is that they leverage controlled breathing patterns to optimize airflow and dislodge thick mucus. Instead of just a forceful, unproductive cough, these methods help move mucus up the airways, making it easier to expel. This controlled approach reduces irritation and helps maintain lung health over time. One of the most widely recommended techniques is the active cycle of breathing technique. Often referred to as a CBT, it involves three main phases. First, controlled breathing, where you breathe gently at your own pace, focusing on relaxation. Second, deep breathing exercises, which involve taking slow, deep breaths, holding them for 2 or 3 seconds, and then exhaling gently. Finally, forced expiratory techniques or huffs, where you take a medium breath and then breathe out quickly and forcibly, like fogging up a mirror, but without closing your throat. Another helpful technique is diaphragmatic breathing, where you focus on breathing deeply using your diaphragm, allowing your belly to rise with each inhale and fall with each exhale. This can improve lung capacity and reduce shallow, ineffective coughing. Consistently practicing these breathing exercises is like giving your lungs a regular workout. It not only helps with immediate cough management, but also strengthens your respiratory muscles and improves your overall airway clearance routine. Incorporating these into your daily life can truly enhance your quality of life, providing a sense of empowerment in managing your condition. By understanding the science behind controlled breathing and actively applying techniques like a CBT and diaphragmatic breathing, you gain valuable tools to proactively manage your cystic fibrosis cough. This leads to more efficient mucus clearance, fewer disruptive coughing episodes, and ultimately, a more comfortable and healthier breathing experience.